Welcome back. The topic today is, can anemia cause swollen leg and feet? Yes, of course it can cause swollen leg and feet. We all know what is anemia. When the RBC, the red blood cell count is low or hemoglobin is very low, it's called anemia. And we all know what the commonest cause of anemia is. Iron deficiency anemia or blood loss is the commonest cause of anemia, and their treatment in the previous videos. Okay, how anemia causes swollen leg and feet? Usually fluid in the body is in the three compartments, we call them. One is vascular compartment, the blood vessels, where the blood is there, it is also fluid. So the vascular compartment, and within the cell we call it intracellular compartment, and there is in between the cell, that's called interstitial space. This space is very important. Usually it has very less fluid. When the amount of fluid in this interstitial fluid increases, then the area becomes swollen. Okay, this is the same principle. Suppose somebody has anemia, the blood is very thin. So when the blood is very thin, the body tries to make it very thick by excreting or pushing the water in the thin blood outside. So when the water comes out of the vascular compartment, it goes into the interstitial space. So they can get swollen feet, swollen ankles especially. That's called pitting pedal edema. What is a pitting? So suppose you press, 5 to 10 seconds, and you remove the finger, it forms a pit, it forms a dent kind of thing. So that's called pitting pedal edema. That means there is an accumulation of fluid. It can happen for so many other diseases as well, but anemia is one of the main reasons. So pitting pedal edema. Not only fluid accumulates in the ankle or feet, but it can occur in the hands or heart, lung, the space, or throughout the body. That's called anasarca. That can happen in the extreme cases. So water and fluid retention. Then when the anemia, the blood is thin, so body makes it thick. When it pushes the fluid outside, it goes to the interstitial compartment, causing edema. The next is very important thing is it's called high output failure. Usually it acts as a it mimics like a cardiac failure. It's a high output failure because of the liquid nature. It acts as a high output failure, causing the same edema kind of thing. And mostly when the anemic people have low BP, because of low BP, the blood for filtration going to the kidney is also very less. So because of that, it produces some changes, causing again water retention, and it can cause pedal edema. And very important thing is this anemia, when it causes kind of something like high output failure and renal problem, the body creates a situation called neurohormonal changes that happens in cardiac disease and kidney disease. So these neurohormonal changes again can cause fluid retention or pitting pedal edema or swollen legs and feet. So anemia, like any other disease, can cause swollen legs and feet because of accumulation of fluid. That's called pitting pedal edema. The reason being fluid and fluid and salt retention. It mimics like a cardiac disease or the kidney disease, creating neurohormonal changes. And the high output failure, because the blood is very thin. To make it thick, the body pushes the water outside, causing swollen leg and feet. Suppose you have a swollen leg and feet, kindly consult your doctor and get yourself examined by him. Thank you.